Researchers in Minnesota have been hard at work developing a new weapon against the coronavirus outbreak.
Antibody tests could be a key to fighting the disease. So how do they work and why are they so important? Those are good questions for Heather Brown.
When did you start thinking about this?
Oh, immediately.
Dr. Mark Jenkins really started to worry when he realized how hard it was to get a nose or throat swab COVID-19 test.
Because they simply do not have enough tests to go around anymore.
So he and his team created a different kind of COVID-19 test, a blood test, that would detect antibodies. It would tell people often after they recover if they had the virus.
It's going to take about at least a week after the infection. It takes time for the immune system to detect the virus, ramp up and start making these antibodies. And so this test is not really useful for early diagnosis.
Right now, there are already dozens of similar tests on the market.
When we're in this period where the demand is so high, I think we have to really consider local expertise, local capability.
So why does it matter so much to know who had it and who didn't after the fact?
To understand in the whole population how many people have been infected.
It's very likely that there are a lot of people out there who have been infected with the new coronavirus but had little, few, or maybe no symptoms at all.
And that's what we really need to get a sense of how widespread the infection really is.
It could help better understand fatality rates or identify recovered patients whose plasma could be used to help sick ones.
I'm hoping that I can help people. If you get this once, do we really know if you'll be immune to it?
No, we don't.
But Dr. Jenkins points to studies of similar viruses as well as research on primates with COVID-19.
I think it's very likely that there will at least be short-term immunity.
If we had that and you had natural immunity to this, certainly that gives us the ability of who wouldn't need to be quarantined, who could be out and is not infecting others.
That kind of information could be used by policymakers to decide, should people go back to work?
Or help others.
They are probably psychologically could be in a better position to do that.
Heather Brown, WCCO 4 News.
U of M researchers are still in their trial phase. Mayo Clinic researchers evaluated tests already on the market. They have chosen one, and they hope to offer it at Mayo next week. However, that test would not be readily available for everyone right now.